So Tapley, thanks for sitting down with us. I'm always intrigued what people think when they watch videos. So if a practitioner is watching this video and the first thing they hear is PRP, what's going to be the common reaction?
I've been there, done that. I've totally moved on to using stem cells or what other type of regenerative medicine therapy there is out there.
So why do they push back? What's the reason?
Well, I mean, I think that medicine and science just totally moved away from the extent of what PRP could potentially do, and they just went ahead and moved on to other more complicated things and more specific things, when in fact the truth is, with all of these therapies, there's a dosing inaccuracy. And so it doesn't matter what therapy you're trying to do, if you don't dose it appropriately, you're not going to have any type of clinical result. Or more specifically, you're going to have outcomes that are, yeah, some of my patients get better, some of my patients don't get better.
So it's a coin flip.
It's a coin flip.
So how is TrueDose different? How does TrueDose change that equation for a practitioner?
Well, what we created was a testing platform, so for point of care use. And the testing platform incorporates artificial intelligence. So now that I can have a patient come in and I want to treat a patient with this condition, and I know that I want to have this dose strength to make sure that this person heals. The artificial intelligence takes all of the variability out of the entire preparation process, the entire process in general of making a cell therapy and making sure that the cell therapy has a consistent healing dose. Basically, the literature is screaming for standardization. They're screaming for ways of doing things consistently, because if you don't do things consistently, and if you don't attribute dose to an outcome response, how are you ever going to know the extent of what these therapies can treat? You won't.
So walk me through the process for a TrueDose patient. What would happen? What would the practitioner do with the patient, and how do we determine that dose?
Patient walks in, they have a finger stick to take a little sample of their blood. That blood goes into the analyzer. Analyzer takes a measurement, and that measurement goes into the artificial intelligence software. Then the artificial intelligence software, by you defaulting, I want to make sure this patient is treating this condition, and I want to make sure they have this dose, and I want to inject this amount of treatment volume. The artificial intelligence is going to tell you exactly how much blood you need to take from that patient in order for that patient to receive that specific dose.
So every patient gets a dose that is specific to them at that time?
At that time. 95% accuracy.